Welcome to the River City Hardball podcast, the place to talk baseball in Jacksonville. A great pleasure once again to welcome on my friend Dr. Jacob Evanich. He is with Optimized Physical Therapy and Sports Performance. Doc, tonight we're going to talk about a sickening injury for Mike Soroka, the Braves right-handed pitcher. He suffers another Achilles tear, so really unfortunate news. We're going to dive into his Achilles tear, how that happens, what happens afterward, the rehab and recovery, and also want to get into the services that you do offer. But first things first, how you been doing? Great to visit with you once again.
Yeah, doing great, Gibby. Thanks for having me on. Really look forward to these.
Yeah, me too. We've had a good time these last couple weeks, just talking about rehab and recovery and citing specific examples. Last week we talked about Tyler Glasnow and his UCL injury and how he's trying to make it back without going with an operation, and we certainly hope the best for him going forward. But let's go into Mike Soroka, the Braves right-hand pitcher. He was a stellar pitcher for the Braves, really a foundational piece, was an all-star in 2019. He tears the Achilles early August, and then he has a follow-up procedure because of a setback in this past May, and now he's just walking to the clubhouse the other day, and he feels a pop, and that pop means after the MRI showed another tear. He tears his right Achilles again. Man, that's just a tough – is that just like bad luck? How does that happen, I wonder?
Yeah, well, first of all, let's appreciate his stuff, and hopefully he gets back, because looking at some of the stats on him, I mean, 2.8 ERA, over a 3 K to base on ball ratio, which is incredible. So hopefully the Braves can get him back and get that version again in the future. But yeah, how it happens, I mean, unfortunately, it seems like the first one was kind of a freak thing. If you look at kind of the mechanism of how it happened to him, I mean, he did exactly what typically happens. I think a lot of us watched Kevin Durant a couple years ago during the NBA playoffs, and kind of like that. So we call it, first of all, the Achilles. What it does is it's the calf muscles. So there's two muscles. It's your gastroc and then your soleus muscle, and they attach into that Achilles, and it attaches onto your heel. And then it helps with what we call plantar flexion, where it's you're pointing down your toes and foot to do things like jumping. The opposite direction we call dorsiflexion is when you're bringing your toes up toward you. In his instance, he was running off the mound. He ended up planting that foot, so he was in a lot of the dorsiflexion, where his toes are really up towards his shins, and his knee was completely straight, so it puts that muscle and the tendon on complete stretch, and he tried to push off. And when you're pushing off in that position, a lot of times the majority of your weight's kind of more on the part of your foot towards your toes, and that's kind of the most common mechanism. And sometimes it's just a little bit too much for the tendon itself. A lot of times people, the other thing that kind of happens, that's the mechanism, but there's the tendon itself actually can kind of degenerate over time. And sometimes you have a little bit of discomfort. We always hear like tendonitis and everything. Sometimes more we call like a tendinosis, where there's a gradual degeneration of that actual tendon. And sometimes people can be asymptomatic when it's happening, but over time that tendon's kind of decreasing in how strong it is. And then when you have that sudden movement that requires a bunch of force to go through that tendon, all of a sudden it reaches its breaking point, and that's when we get the actual tear.
Dr. Jacob Evanich with us from Optimized Physical Therapy and Sports Performance. He partners with our friends over at DBAT. If you want to check them out, dbatjax.com, and we'll get more information as we move along. Talking about Mike Soroka, the Braves pitcher, again, who suffers another injury to his Achilles. The follow-up procedure back in May, there was a setback. Wonder what that could have been.
Yeah, so from what I could see, obviously it's hard to find any specifics on everything that was going on with his medical history. But I had seen that they made mention that the sutures didn't necessarily take completely for that Achilles. So when you're having the operation, what they end up doing is they're basically tying the torn pieces of the tendon together. So sometimes there's a partial tear, so the whole tendon isn't completely severed. And then if it's less than about 3 centimeters, typically they'll consider going non-operative for the route to let the body heal itself. and then it's less of a rehab timeline, so he can get back to playing a little bit sooner. In his case, it seemed like it was a complete rupture the first time. So they do have to completely sew that tendon back together. Better sooner than later. If you wait a little bit, it decreases how good your outcomes are long term with regaining the strength of your foot with the plantar flexion. So when they did the sutures, they also sometimes they do put a graft in there also to help re-solidify and re-strengthen that actual tendon. And they use a couple of different muscles in your legs. So they use it's called your plantaris muscle. They also use your peroneus brevis muscle. And then they also use your flexor hallucis longus muscles. So a bunch of long words for basically some muscles that are right around that calf and also help with some of the plantar flexion, but not to the extent that the calf muscle, the gastroc and the soleus do. Those are the main ones that do that motion. So they can put that around the actual repair, and it can help heal that a little bit more solidly. But in his instance, if those sutures for whatever reason didn't take, it's hard to say exactly why without having more of the details of the actual surgery and everything. That causes the tendon to basically just not fully repair. And then it sounded like once he got back to throwing, I had seen that he started having actually some shoulder issues that ended up shutting him down. And they think the cause of the shoulder issues is because when you're throwing, whole body works together. So if he's having some of that discomfort in the Achilles, it's going to throw things off with the way he's throwing. And it ended up causing some shoulder inflammation. And then that seems like it's when they finally decided to go in for that second just kind of look. It was more of they call it like an exploratory surgery. So they didn't really do anything. They were just kind of checking the repair and seeing what was happening. And it seems like that's when they found that the repair didn't necessarily take. So then it sounds like they put him back in the boot to try to be careful with it, try to let some more healing take place. When he came back out of that boot for whatever reason, it was just a little bit too much of a stress for that tendon, and it had to have just kept weakening over time. And then finally it just tore again because that repair didn't actually take.
Yeah, I saw the Braves manager, Brian Snicker. His quote was, it was his first day out of the boot. And then he's walking to the clubhouse, and all of a sudden, I guess he felt a pop again. Explain what the pop means.
Yeah, so a lot of guys will actually, I've seen it in a couple, especially track runners in the past. But it'll almost sound like a gunshot sometimes. So it's so loud. That tendon is so strong. It's the strongest tendon in the body. So much force is going through it. So yeah, it'll sound like almost a gunshot. Somebody will feel like they got either like shot in the back of the ankle or like kicked in the back of the ankle is what a lot of people will say. So that's one sign that it was potentially an Achilles, a major Achilles injury. Another thing is if you actually go down afterwards and feel along that Achilles, you'll actually feel a little bit of a gap where the actual tear is. So it won't feel smooth anymore. So that's definitely a sign that you have a major issue going on. After that, some swelling will instantly kind of come into place. Bruising will come in over time. Pain will increase. One of the major things we really look for is, are they actually able to point that foot down on their own with the plantar flexion motion? If they can't, that's because the muscles that attach to the muscles are still working or trying to, but if they're not attached to that tendon that's attached to the bone, you're not going to get that movement. So a lot of times you'll see another example, Kobe was a really famous guy who ended up having the Achilles injury. And when you see him walking off the court during that, he can't push down at all. So it's like his foot is just staying flat the whole time. That's another sign we're kind of looking for that something major is going on with the Achilles. We do a couple other tests. Usually those things will kind of key in. And the last thing we do is we just squeeze the calf muscle itself. And if usually squeezing the calf muscle will cause that foot to plantar flex and point down. If it's not doing that when we're squeezing and there's a lot of pain, we're definitely thinking Achilles tear. So then you go in for imaging. The imaging just kind of confirms what you can already tell with those things, and just kind of tell you exactly how big the tear is and where to go for rehab options.
A few more minutes here with Dr. Jacob Evanich talking about an Achilles tear for Mike Soroka, the Braves stud pitcher. So when you have an Achilles tear, the rehab for that is pretty grueling, isn't it?
It is, yeah. So there's actually, in Soroka's instance, he'll have the surgery. Now that it's his second time, he has the best in sports medicine, everything possible to try to help him get through this. So the normal people who end up going through this, like you and me, who might not have access to that, your outcomes are definitely decreased in coming back from it. In his instance, he is running the instance of having a little bit decreased strength and performance out of that ankle, definitely, now that it's his second time. A lot of times, some of the rehab is changing over time to try to get these guys back to moving a little bit quicker, to try to help the healing process, along with getting them back to play a little bit sooner. Typically, you would be in a boot for about 6 weeks, just letting everything heal up, kind of resting, letting the body heal the area. After the 6 weeks, then we're looking into getting into kind of a typical walking boot that you would see somebody walking in. Around that time, you're starting some rehab as well, with just some active movement of the muscle, making sure we're not letting the tissues get too taut and kind of scarred down, and initiating some gradual strengthening of that muscle so everything doesn't get too weak. And we do need some stress going through that repair to help that tendon healing. Once you're at about that 3-month mark, that's when everything should be relatively healed up, and it's time to really gradually start pushing the rehab. Typically, we're thinking about 6 months or more to actually return to some kind of sports performance. And a lot of times, especially like a Soroka instance, he's going to be a little bit longer than that this time, definitely, because he'll be a little bit more conservative with it. With the rehab itself, to strengthen up that tendon over time, the body takes so much time to gradually strengthen. So you need to start with minimal forces, make sure we're getting the range of motion back in that ankle, especially after it's been sitting there for a while in the boot. Everything's just going to get pretty tight, which is okay. You can gradually increase that motion back to pretty much full. So we're looking to try to get it about 90% at least before he comes back to really playing baseball. We want it to be at least 80% of the strength of the other side when he's coming back to baseball. We want to make sure he can bounce really well, so a little bit more of the dynamic movement that's checking out also. And we want to make sure his mechanics with walking and running are normal as well. So those are some of the things you're looking for to really get him back to playing. And then there's always other specific tests for performance that you might do for him, and kind of cluster some tests together and see how strong that leg really is before he fully comes back. Like vertical jumping is a great one. Just to really see how strong that tendon really is when you're only using that leg.
You know, when the Achilles tear, if you're an older athlete, it's tougher to come back from, right? But for Soroka, he's going to be 24 in August. So you would think that a guy as young as he is, even though he's had now a second tear, should be able to come back, right?
Yeah, definitely. That definitely helps. The youth will always help the healing process, along with, like we were mentioning before, some of the modalities that those guys have available to them will definitely help the healing process. Once again, I'm just really not sure exactly why those sutures didn't take. It's hard to say if there is a little bit of a genetic factor. That's a little bit more hypothetical at this point. So without the full information, it's hard to tell. But what's interesting is actually the Achilles, it is relatively common compared to other surgeries to have a re-tear. So we're looking at like a 4.5% re-tear rate, and younger guys are actually at a little bit of a higher risk for the re-tears for whatever reason, whether they are just a little bit more active in general, and able to produce a little bit more force through the tendon. Just some thoughts on that. But it is interesting to know that some of these younger guys are at a higher risk for the re-tear. It's just typically it doesn't happen when a guy is just walking to the actual field. It's happening when they're out on the field performing again.
Yeah, I mean, just the bizarre nature of that, I feel like is worth discussing in and of itself, because, you know, number one, to have a guy that's 23, he's now suffered a second tear. Part of that, you know, the second tear, the re-tear, I guess you could say, is that because of just the tendon's not ready? Is it the rehab wasn't necessarily going as well as it should have been going? Where do you put the emphasis on that?
Yeah, the medical teams within these major organizations are amazing. So the doctors are amazing doing the surgery. The rehab professionals are amazing. Some guys, it's just everybody responds a little bit different to everything. So it's hard to tell exactly what happened, but definitely for whatever reason, the tendon wasn't completely healed and it just wasn't at the point where it could take any, obviously really any stress at all if he was just walking.
Yeah.
So it was just the tendon for whatever reason was very, very weak.
I wonder if they maybe tried to rush him back a little bit too soon. I don't know because we don't know the specifics of the case, but to me it would seem like maybe he was rushed a little bit.
You could be, yeah, because once we were in the beginning, we were kind of talking about how degeneration of the tendon is a risk factor for having this occur, and probably what was happening to him before he had this injury, the full blown Achilles tear, without him necessarily knowing. So if you do suddenly increase your activity level, which a lot of times a guy like that, he's so competitive. So it's possible that, yeah, he started really rushing things and then you start having a little bit of degeneration of the tendon again as well.
For a baseball pitcher, is it easier? Is it tougher to come back from an Achilles like, say, a basketball or football player would?
I think so, yes. But at the same time, I mean, just because those guys are doing it so often throughout the night and really exploding up and jumping to contest the shot, to go up and slam dunk, to shoot their jumper, so they're constantly always using that Achilles tendon. With a pitcher though, still, especially a starter, you're thinking 100 plus times a night, you're really driving off that foot, you're really exploding off, and you're creating that plantar flexion torque. And we generate the velocity of the ball by generating force from the ground through your foot and all the way up, eventually through your hand. So that's where that energy generation starts. So it's you definitely need to be able to generate some major torque off that ankle. So he needs that Achilles, and he needs it to be as strong as possible to be as effective as he was previously.
Yeah, and we certainly wish the best of luck. It's really a gut punch
Absolutely.
for Mike Soroka, a terrific young pitcher for the Braves, now going through what really looks like a third procedure. I know the second one was an exploratory procedure, but still, this will be now the third operation. Yeah, exactly. It'll be the third operation now on that right Achilles tendon, and we certainly wish him the best. Jacob, in the few moments that we have left, let's tell us, our people listening and watching, about what you guys offer, some of the services at Optimized Physical Therapy and Sports Performance.
Yeah, absolutely. So we're focusing on the baseball and softball populations in the area, along with active individuals, active adults. We're providing physical therapy services for majority of all injuries. Baseball and softball are such skill sports in general, so the rehab needs to be really directed towards that skill. It can't be just a one size fits all. So we saw a need for it in the area, and we're trying to fit that need for the baseball and softball populations of Jacksonville. With how good the sport is in this area, they deserve the best. So we're trying to give that. We also provide sports performance services just to maximize speed, strength, power, and just general movement and improvement of movement to really perform on the field. We offer arm care programs also, just to kind of show guys, because that's a thing that's easily missed a lot of times that we've seen. Just general arm care during the weeks to really make sure your arm's ready to go for your start on a weekly basis, and just to kind of show them also just general throwing programs to gradually increase their throwing velocity, how to safely go about that process. And we also provide some manual therapy services if somebody's at the point where they feel like that's all they generally kind of want in the meantime. If they're having some muscle tightness and things like that, and they want to try to find a way to continue to perform, but need a little bit of an aid, a lot of times the manual therapy can help with that. So we provide general massage. If it's physical therapy, we do mobilizations if needed. And then also we provide cupping, which we've seen really helps to relax some of those tight muscles in general.
The baseball and softball players in Jacksonville need to take advantage of these services provided by Optimized Physical Therapy and Sports Performance. If you're a baseball and softball player in Jacksonville, you want the best, come to Dr. Evanich, and he will provide the best. And we certainly appreciate his services and work here on the podcast here on River City Hardball. Another great discussion. Really appreciate your time, and we'll do it again next week, Doc.
Sounds good, Gibby. Thank you so much.